Hi, good morning. Mood swings, fatigue, problems with sleeping at night, and focusing during the day, weight gain. The list goes on. Many of us dismiss the symptoms as a result of a stressful lifestyles or perhaps just getting older. But is your body sending you an urgent message? January is Thyroid Awareness Month. Joining us to discuss what these signals could mean is Dr. Jeffrey Garber, speaking on behalf of the American Association of Clinical Endocrinologists, and Ronni Hochman, who suffers from hyperthyroidism and is a patient of Dr. Garber. Doctor, what exactly is hypothyroidism?
Hypothyroidism is when your thyroid doesn't make enough thyroid hormone. It's also Hypothyroidism is when your thyroid doesn't make enough thyroid hormone. It's also known as an underactive thyroid. The thyroid is located at the base of your neck and produces hormone that influences the rate that your body uses energy. So if you don't have enough thyroid hormone, every cell, tissue, and organ in your body can be affected, and things can really slow down dramatically. Everything from the rate at which you think, your energy level, the amount of sleep you need, and your bowels can be affected. And the list, as you pointed out, does go on.
Doctor, why does this condition often go underdiagnosed or is misdiagnosed as something else?
Because virtually all of the symptoms that I just mentioned and could continue to list are symptoms that all of us experience from time to time. And sometimes we experience them, and there are good reasons for it, like not getting enough sleep is a good enough reason to be tired. The trick, if you call it that, is to be aware of what's not right for you. And so if it persists and there isn't an explanation, one needs to pursue things a bit better and to get more information about whether it could be your thyroid by going to our website, thyroidawareness, that's one word.com, and then go to your physician and raise the question about whether your thyroid could be the culprit.
Thank you. Ronni, I'm sure you've had this question before. How did you find out there was something wrong with your thyroid?
It was a process of elimination after experiencing fatigue and irregular bowels and puffiness in my face and all kinds of things that were unexplainable to me. I underwent a couple of different tests. One was a colonoscopy, which proved negative. One was lactose intolerance testing, which proved negative. And eventually the light bulb went off in my doctor's head, and we had a simple blood test that clearly diagnosed me, because my levels were extremely low, that was the culprit. And once that was addressed, that I would be back to normal again, and that's exactly how it played out.
Ronni, how is your health and lifestyle now since you've been diagnosed?
It's back to normal. It's dramatically different. I do get tired from time to time because life exists, but and actually any time that I do feel that some of the symptoms are coming back, I go back and I get tested again. And sometimes we do have to regulate the dosage, but it's a very, very easy fix, and knowing what to do, because knowing what I have just makes it very non-stressful.
Ronni, could you just give us a few of the symptoms that you had experienced?
I would say the biggest symptom was severe stomach pains. I wasn't sure, am I eating the wrong foods, whatever, which was, very troubling from day to day. I was extremely tired. I would sleep 10 hours, 12 hours, wake up tired. Everything seemed to just be slowed down. I didn't have the energy level that I used to have, so it was dramatically different.
Thank you. Doctor, what are some treatment options if someone should have an issue with their thyroid?
Well, certainly if their thyroid is low enough and they're having symptoms, they should be unequivocally treated. And it can be best treated with a single pill once a day known as T4 or levothyroxine, and taken at the same time, the same way, before food, and to be checked regularly to make sure the levels are in the proper range and that adjustment doesn't need to be made, and occasionally they do, because the condition can change from time to time.
Thank you. Ronni, is there anything you'd like to tell our viewers about how important it is to be aware of your thyroid?
I would caution people to find out about family history, because I found out after I was diagnosed that my mother also has hypothyroidism, and subsequently my daughter also does. So I think there are cases where it's hereditary. So I think it's important to find that out. And then also, I think it's really important that we're on now talking about thyroid awareness, so that that is something that would be in the forefront of a doctor's mind when a patient comes to him and asks for a diagnosis. So again, go to thyroidawareness.com, and there'll be a lot of information there that'll help people understand. So maybe before they go to the doctor, they might have that information and say, this sounds like me, and bring it up.
Doctor, is there anything you'd like to add about hypothyroidism?
Just that if you're not feeling right for a fair period of time and you can't explain it, particularly as Ronni pointed out, if there's a family history or even other conditions that are more commonly seen with hypothyroidism, whether it's type 1 diabetes or rheumatoid arthritis or lupus, go back to your doctor and say, please check that.
I would like to thank you both for joining us today for Thyroid Awareness Month. Have a great day.
Thank you.